So definitely mucosal and no ulcer scar. So please take care. So less than 2 centimeter region. So in other words, purely flat lesion less than 2 centimeter is a candidate for mucosal resection. So anyway, so how can we detect mucosal cancer in the stomach and the esophagus? Like that. First is the identification of the region by the color change or region elevated or slightly depressed, like that. And then next step is the endoscopic diagnosis of carcinoma, malignancy evaluation. And then finally, the evaluation of infiltration depth. So like that. First thing is that the recognition of the region is a key point to evaluate. So color change for flat lesion. Sometimes redness, sometimes fainting, pale, or like that. And the next point is the changes of height on the mucosal surface. So when we use image enhanced endoscopy, I mean NVI, sometimes 5 magnification, we can detect the brownish area. And of course, conventional chromoendoscopy is useful. Lugo solution in the squamous epithelium as a Lugo voiding area. So this is a sample. So in the left-hand side, you can see a little bit reddish change on mucosal surface. And when we use NBI, we can see much better. So this kind of generally flat lesion, 2A, 2B, 2C, flat lesion is a mucosal lesion. So conventional chromoendoscopy, spraying of iodine, we can recognize lesion much better. So we perform EST for this case, and cancer limited to epithelium carcinoma in situ. So another key point, I mentioned the change of color is a key point to detect the lesion. And the another point is that the minute change of the superficial height, I mean depression, slight depression or slight elevation. So now you can see left-hand side of the white light, reddish color change on mucosal surface. Now after spraying of indigo carmine, we can identify the slightly depressive change. We can identify the depressed area with some erosion. Okay. So using NBI magnifying endoscopy, we can recognize some change of mucosal character. So this is the background normal foveolar epithelium in the stomach, and in this area, this pit pattern, gastric pit pattern, has almost distracted, and then irregular micro tumor vessel can be observed like that. So when we detect this kind of change in the gastric mucosa, we can diagnose this is the adenocarcinoma, baby cancer, well differentiated. So this is the pathological data. So no invasion at this moment, but this is the precancerous region in Western criteria. Western criteria is that the invasion is a key point to identify the carcinoma. So in Vienna classification, in Wien classification, this region is intra-mucosal neoplasia. Okay. So we can make diagnosis of malignancy with abnormal tumor vessel and irregular pit pattern. Irregular pit pattern means irregular glandular surface